Introduction: Why my story may reflect yours. Now that you understand the motivation behind my mission to create this resource for you, let's explore your health story. To start off this discussion, I will share some of my own personal experience as a dizzy patient navigating the healthcare system. Getting personal: my healing journey. In 2002, I first realized I had a problem with my ears. I had just graduated with my master's degree in physical therapy and started my new career working as a licensed physical therapist, or PT, at the Shock Trauma Center at University of Maryland Hospital in Baltimore. One day, my manager pulled me into her office to notify me that she had received a complaint from a nurse supervisor because I was talking too loudly when I worked with my patients on the floor of the hospital. The nurse had complained that, apparently, I was disturbing other patients who were trying to sleep in the next room. I was surprised to learn of this complaint because I did not think I was being too loud, so my manager asked me to get my hearing checked. That hearing exam in 2002 showed a hearing loss in my left ear that would qualify me to wear a hearing aid at only 23 years old. This was the first crack in my goal to project an image of strength and competence as I entered the PT healthcare profession. As my personal health journey became more convoluted, some of my experiences and concerns may resonate with your own journey. Of course, like many people, I refused to get a hearing aid, especially at such a young age. It was the first time I ever realized that I might have any permanent problems with my ears. Yet at that time, I had no idea how significant the damage to my ears could possibly be from so many recurrent ear infections as a child, including frequent swimmer's ear. Dizziness and vertigo started for me in first grade when I was knocked unconscious while sledding down a steep hill in Rhode Island. That major concussion caused my first memories of dizziness, vertigo, blurry vision, imbalance, and nausea. Multiple concussions as an active, athletic child launched my health journey as a dizzy patient. Shortly thereafter, while I was still in elementary school, I started battling with migraines. I remember my mom taking me to Fort Meade Hospital in Maryland on multiple occasions to get a Demerol shot in my buttock to reduce the pain, stop the vomiting, and allow me to fall asleep. I distinctly recall the first migraine I ever had. I was lying in my bed crying for hours. It felt like a big, strong man was sitting next to my bed, squeezing my skull as hard as he could, with huge hands and exceptionally long fingers. I remember I could not even move or open my eyes. Then I began vomiting repeatedly, and my mom took me to the hospital for emergency care. I have probably been to the emergency room, or ER, at least 20 times in my life due to uncontrolled migraine pain, dizziness, vertigo, and unceasing vomiting that lasted for hours to days. Once I got older, the migraines became more frequent and severe. Emergency room doctors are highly skilled healthcare providers and have come to my rescue so many times. The magic ER cocktail seemed to consist of narcotic pain medication, anti-nausea medication, a tranquilizer, and intravenous or IV hydration with electrolytes. The ER cuisine consisted of saltine crackers and apple juice. I always enjoyed the warm blanket the nurses offered to slow down my shivers. The worst part of seeking care at the ER was the blinding fluorescent light in my eyes the whole time until I stopped vomiting and crying because I passed out from the drugs. Before I discovered the root causes of my discomfort and learned how to care for myself as skillfully as I do now, I was at high risk of becoming a prescription drug addict, as many migraine sufferers are. I was taking triptans orally and by injection 2 to 5 days per week, which is not recommended because this type of medication can cause cardiac side effects at high usage and is generally only for intermittent use. I carried a purse full of prescription muscle relaxers, anti-inflammatories, opioid pain medications, strong non-narcotic painkillers, and anti-nausea suppositories. I often had rebound headaches from taking so much medication. But I still forged ahead, putting my career and my job performance before my health and well-being, using medications to mask every different symptom as it arose throughout each day. I was drinking coffee every morning and skipping meals during the day because I was too busy working to eat. At night, I was drinking a glass of wine to unwind and relax, then staying up until midnight or 1 a.m. to check my emails. One time, I even drove home from my office with an extreme migraine, holding a trash bag on my lap because I was vomiting sporadically. I felt the dizziness, nausea, and headache coming on while I was at work, and I knew that if I stayed at my office, I would get stuck vomiting and lying on the ground in the public restroom in my office building. When my friends later found out I had driven my car while I felt extremely dizzy and nauseous, they made me promise to call someone for help next time or to call a cab. It had not even occurred to me to call someone to ask for a ride, since I was so independent and enjoying so much professional competence and success at that time. I was determined to be strong and not let anyone see my weaknesses. The care I received became part of the problem. I remember one time around 2008 when a particularly severe episode of dizziness, vertigo, vomiting, headache, blurry vision, off-balance hell lasted well beyond the first ER trip. That day, I was having the worst headache of my life. Since my symptoms were so severe, I was worked up at the ER for a subdural hematoma, which is a stroke caused by a bleed in the brain. To check for the subdural hematoma, the ER doctors performed a spinal tap or lumbar puncture to look for blood in the clear fluid that surrounds the brain and spinal cord, or cerebral spinal fluid, CSF. They didn't find any blood in my cerebrospinal fluid, so they decided that I must not have had a stroke, thank God, and it was simply the worst headache of my life. I was thinking, that's what I told you when I came in here 8 hours ago. Then I was sent home with the magic ER cocktail of medications to treat all my symptoms and told to sleep it off. When I woke up, my headache and dizziness were even worse, and I could hardly stand up or walk to the bathroom. Can you imagine how the worst headache of your life could possibly get any worse? It was so bad that my mother had to get on a plane immediately and fly to California on the same day to come help me because I was having a migraine, dizziness, blurry vision, anxiety, vomiting, and headache pain crisis. Basically, it was a total meltdown. Death seemed like the best option at that point. I was hysterical and could not get off the couch because my head hurt so bad, my dizziness was so severe, and I could hardly see. When I returned to the ER again a day later with physical assistance to even walk because I was so weak from vomiting for days, the ER physician realized that I was having an adverse reaction to the spinal tap. I later learned that is fairly common, but I had been uninformed of the risks and was unaware of the possibility when I consented to the procedure. I have since learned that as many as 25% of patients who have a spinal tap develop a headache from the cerebrospinal fluid leaking after the puncture into the nearby tissues. These post-puncture headaches typically last for hours to days after the spinal tap, but can last for a week or more. Like mine, the post-puncture headaches often co-occur with nausea, vomiting, and dizziness. The bottom line is that the diagnostic testing I received when I sought care at the ER had made me feel even worse, piling on top of my other symptoms. To prevent these severe, debilitating migraines, a well-respected neurologist I followed up with wanted to put me on a cardiovascular medication called a calcium channel blocker. I was only 30 years old and otherwise healthy, so this treatment plan did not sit well with me. I refused because I knew about the side effects from that type of medication, and I didn't see an end in sight if I started taking that medication so young. Another option was to take an anti-seizure medication, which is also used to prevent migraines. However, this particular medication has such severe side effects that women are strongly advised against getting pregnant while taking it due to the high probability of birth defects. As a woman of childbearing age, that did not appeal to me either. Basically, the treatment options I was offered would have created more problems for me. I was so discouraged. I had spent years going from doctor to doctor and accumulating prescriptions with no real answers or solutions. I had spent thousands and thousands of dollars with limited to no improvement. I even experienced dizziness as a side effect of my medications. One day, I looked at all my bottles of prescriptions, reflected on the recent trips to the emergency room that had not been prevented, and decided there had to be a better way to live. I realized that I was hitting a series of dead ends, and there was not a well-worn path for people like me within the healthcare system. I had sought medical care since childhood for pain and dizzy spells, but I noticed the pain was being addressed with medications, and my dizziness had largely been disregarded by my healthcare providers. In order for my life to improve, I knew all my symptoms had to be accounted for and addressed, but how? My breakthrough. For the longest time, I was not sharing with others what I was going through because, like many who suffer with dizziness, vertigo, anxiety, and headaches, I didn't understand what was happening or how to manage it. And I just kept pushing myself. I have since learned that the perfectionist, type A, overachiever, high performer is a typical personality type that often co-occurs with dizziness, headaches, anxiety, and neck pain. In fact, when I attended the first offering of the Advanced Practice in Vestibular Physical Therapy course created by the Academy of Neurologic Physical Therapy, or ANPT, of the American Physical Therapy Association, APTA, in 2010, I realized that I was a classic vestibular presentation. The instructor discussed a case study of a younger patient with similarities to my story. Since I had been exclusively providing vestibular physical therapy to homebound older adults in a home health setting, the extent and impact of vestibular disorders on younger patients had not yet crossed my professional path. I certainly had not pinpointed my own personal health issues on a possible vestibular cause, and more importantly, neither had any of my doctors thus far. Although I had been diagnosed with migraines since childhood, no healthcare provider had ever discussed with me the possibility that I also had the elusive subtype of vestibular migraines. These are episodes of dizziness and vertigo that can last for 5 minutes to 3 days and often occur without a headache. It was literally a defining moment in my life. All at once, I realized that I was and didn't want to be a classic case study anymore. I had already switched to working with an integrative neurologist, and she suggested that I take extended time off work on disability to prioritize my health. In 2011, I gave in to her suggestion. My integrative neurologist pulled me out of work on disability so she could help me figure out how to get off the prescriptions that were not helping me and simultaneously dig into the root causes of my debilitating dizzy spells that had frequently landed me in the emergency room. I made a firm decision that I did not want to continue to barely survive between vertigo emergencies, so I committed to solving my own case and making the necessary lifestyle changes to hold my symptoms at bay. That was the beginning of my personal healing journey after years of worsening, quote-unquote, cures. I share all that to let you know that I have suffered worse symptoms due to diagnostic testing. I have been uninformed of the risks of procedures I consented to. I have been offered treatments that would create more problems for me in the long run, and I had to navigate my way through the healthcare system. I had to take time off work to go on disability, and I even had to switch jobs when I returned to the workforce, like many dizzy patients. There was no clear pathway for me through the healthcare system as a dizzy patient seeking care, so I had to hack my way through the mess to blaze my own trail. When I hit a wall, I had to figure out a new direction to go for help, even though sometimes I wanted to give up. Like many of you, I have felt discouraged and disappointed at times. I have been where you are. I have faced similar obstacles, experienced setbacks, switched doctors multiple times, and had to carry on despite all that to get to the place where I am today. I have sought care with so many symptoms that only the pain, nausea, and anxiety were treated with medications, but the dizziness and vertigo were disregarded for years. Complicated case. In addition to the significant hearing loss, I have since learned that I have symptoms of vestibular weakness. I frequently experience recurrent episodes of BPPV, benign paroxysmal positional vertigo, in both ears. I also discovered that I suffer from dizziness and vertigo because of 3 slow-speed car accidents, none of which were my fault, causing a whiplash injury to my neck, cranial tension headaches, and jaw problems. The aggressive orthodontic care I received as a child of the 80s may also play a role in my case. I had multiple teeth extracted due to overcrowding, followed by many years of expander, braces, and headgear with a cervical pull. The continuous pushing and pulling on my skull as I was growing and developing was supposed to help with the alignment of my bite. However, this often painful orthodontic care may have contributed to orthopedic problems with my head, neck, and jaw joint, TMJ, that continually cause tissue tension, facial pain, and chronic localized inflammation. Most likely due to my genetics, I experience dizziness from severe vestibular migraines, which tend to be triggered by sinus problems, gut issues, certain weather patterns, travel, excessive stress, tension in my neck muscles, and any disturbance to my sleep. More recently, I have been dealing with an autoimmune condition, new food sensitivities, and digestive issues that link with dizzy spells. It has taken me many years to realize that all those root causes were contributing to my discomfort. The recurrent BPPV and symptoms of vestibular weakness in my case pile on top of the history of multiple childhood concussions, migraine-associated vertigo, and my other root causes of dizziness. Within my body, these issues are all intertwined, so they can trigger, escalate, and compound each other. Due to my own desperation to feel better and create a life for myself, I have eagerly studied the most advanced, evidence-based vestibular rehabilitation strategies and explored self-care strategies from around the globe. I have personally faced and overcome the mental health overlay of confusion, nervousness, despair, hopelessness, and struggling with the will to live that is often a sequela of chronic problems with dizziness or vertigo. Physically, I have been in a constant battle to try to stay fit and in shape since I have had so many days that I could not exercise due to dizziness or vertigo. I have become physically deconditioned multiple times in my life, losing my muscle strength and my cardiovascular fitness from a lack of activity caused by dizziness or vertigo. At most of my previous jobs, I have taken the maximum sick time allowed for employees. Missing work so many times and frequently canceling social plans has caused me to disappoint a lot of people. My health status has impacted some of my family and friends who worry about my health. In the past, I became a burden to those I love a few times because I was totally incapacitated and in need of caregiving due to the severity of my symptoms. Being of service. As I matured on my path and began to take control of my health, I started asking myself the questions, how can I be of service? How can I share what I have learned with others who are suffering? Being of service to others who suffer like I have helps me find meaning in my journey to this place in my life. That is what inspired my mission to rescue misunderstood and mismanaged people with dizziness, vertigo, and balance problems, and what continues to motivate me today. The insight and innovation in my approach to life, my health, and my work is a direct offspring from my experience. Had I not suffered so deeply for so many years, I would not have been as motivated to master this material and further develop new ideas and strategies to help myself and other dizzy patients feel better. Now I have been able to integrate the insight from many different healthcare providers I have personally consulted as a patient and other clinical experts whom I have studied with in a course or mentorship format. I have pioneered my strategies in my own life, and now I have reached thousands of people around the world who suffer like me. I have written multiple 200-plus page photo-enhanced training manuals and trained hundreds of U.S. physical therapists to care for patients with dizziness and vertigo. In turn, those healthcare providers have also reached thousands more people whom I have never met. In the past, my symptoms caused me severe disability, resulting in lost jobs and friendships over the years. Now that I understand what is happening in my case, I am able to manage all the root causes of my symptoms to live an active and happy life. Dizzy patients are falling through the cracks. Has any healthcare provider ever sat down with me to go over my whole story? No, absolutely not. They simply do not have time. My story is too long and complicated, representing the ultimate challenge in getting proper help for my condition. If I had not taken an active role in advocating for myself, I would still be bouncing around from doctor to doctor and emergency room to emergency room. No one ever looked at the big picture or ensured that all my symptoms could be explained by the diagnoses I had been assigned. This is a common problem for dizzy patients accessing the healthcare system, especially if the dizzy patient also presents with complaints of pain or other medical problems. This is because our healthcare system is compartmentalized, with over-specialization of providers. Each healthcare provider I have worked with is focused on their individual area of specialty. I call it tunnel vision. Often healthcare providers are not even thinking about how problems can occur across many body systems with a cascade effect. They are focused on their one area of the body or one body system. Patients with cancer or heart disease have access to world-class treatment in hospitals completely dedicated to those problems. Once a diagnosis is made for conditions like cancer or heart disease, a clear pathway of referrals and treatment options is laid out for the patient. The care plan for these conditions is well established. Unfortunately, for patients who suffer with dizziness and vertigo, the pathway through the maze of healthcare options is not clear or easy to figure out. This causes a lot of patients with dizziness and vertigo to fall through the cracks of the healthcare system, with no diagnosis, no answers, and no relief for months to years. Many dizzy patients are prescribed medication and forgotten about. You may feel like everything you've tried for dizziness has missed the mark so far. Many patients feel like their attempts to recover from dizziness are an epic failure. I hear from people with dizziness from around the world who are not sure where to go next or who they can trust. If this is you and you are feeling hopeless, I suggest you make a decision right now to turn a setback into a comeback. Keep digging and don't give up. There may be just one more piece of the puzzle that you need to solve your case, or it's possible that there are multiple pieces of the puzzle missing. You may need one or multiple additional healthcare providers to treat different aspects of your symptoms. You may have been relying on one healthcare provider, But you may need a team approach for a full recovery. Don't lose hope. You never know when you may find that missing puzzle piece. As you look at the details of your case and analyze the results you have received so far, I want to point out that usually there are multiple causes of dizziness that are linked and intertwined. The various interrelated root causes of dizziness and vertigo often escalate, magnify, and trigger each other. The Bell Method launch. In June of 2014, after I spent a few years discovering the interconnected root causes of my own complex case of dizziness and vertigo and developing my approach to help others like me, I launched my specialty private practice. I designed my physical therapy practice for people with problems like mine so that I can help them to find answers and relief, one patient at a time. You could say my practice is the golden rule put into action, because I strive to treat my patients the way I wish someone would have treated me, but no one ever did. To educate my local community, I have offered countless lectures throughout San Diego County on the topics of dizziness, vertigo, balance problems, and preventing falls. Since 2007, I have provided leadership to the San Diego County Fall Prevention Task Force, including a total of 8 years serving as the task force co-chair. Some of my educational lectures have been broadcast on television, and many are available to view online. One of the televised lectures I presented as a University of California, San Diego, or UCSD Stein Public Lecture in January 2017 has amassed over 3 million views, prompting calls and emails from people worldwide seeking help. My physical therapy license limits me to offering individual medical advice only to patients within the state of California, so I decided to create this book as a guide to help people like you find proper care in your area. Since healthcare providers are so busy and dizziness is such a complex problem, I hope to guide you to become your own health advocate as you navigate the healthcare system. Not a one-pill-fits-all problem. I caution against a one-pill-fits-all approach to dealing with dizziness and vertigo. Most medications prescribed for dizziness and vertigo actually list dizziness as a commonly reported medication side effect. The root cause is the key for symptom management, reduction, and resolution. Lack of resolution of the root cause of dizziness and vertigo can lead to other issues like cognitive decline, emotional distress, financial difficulties, social isolation, balance problems, falls with injuries, and a reduced quality of life overall. Since the pathway through the healthcare system is not clearly marked for dizzy patients, I propose that you and I work together as a pair of vertigo detectives to gather evidence and find the experts you need to solve your case. You must become your own health advocate. You must blaze your own trail with grace and a calm, focused demeanor. If you cannot manage to advocate for yourself, or you feel confused or overwhelmed, I suggest you find a friend or family member who can advocate for you. I wrote this book to help you on your journey of blazing your own trail within the maze of healthcare options so you can make a U-turn with pep in your step whenever you hit a dead end. My hope is that your answers and treatment plan don't have to take over 25 years to come together like mine did. If you have been given a pill and forgotten about, I hope this book helps you find proper care so you can get answers and relief. As you read, I encourage you to make notes in the margin where an example, description, or suggestion reflects an element of your health story or needs. This may help you identify a suggestion you want to employ or a topic for discussion with your doctor. While navigating the healthcare system as a dizzy patient or as an advocate for one, your educated decisions will provide the best outcomes and prognosis. Here we go, Vertigo detectives. Let's get started.